Hello everyone, I am Dr. Anubhav Gupta and I am a consultant plastic and cosmetic surgeon working at Sir Gangaram Hospital. Today I am going to talk about a procedure called fat grafting or lipo injection. Now the first question which comes to our mind is that who are the group of patients or who are the group of people who can benefit from fat grafting? Well, there are many conditions. For example, we can broadly divide them into reconstructive and aesthetic conditions. In reconstructive, in congenital, that is since birth, many children have an asymmetry of face, that is one part of the face is not as developed as the other part, or a condition called microsomia. So in those conditions, then there are certain females, very rarely though, who have a Poland syndrome wherein one side of the breast is not developed. So these are the conditions which are present since birth wherein we can do fat grafting and we can correct those conditions. Second is post-traumatic. For example, there is a fracture of the face leading to atrophy or the loss of fat from there. There is some depression in the face, some depression in any part of the body, which can be corrected by fat grafting. Many times there is a asymmetry of the breast, small asymmetry of the breast, which can also be corrected. Now the cosmetic indications of fat grafting are usually related to age-related changes, wherein there is a sagging of the facial tissue. Fat grafting sometimes helps in that. And there are many times cosmetically patients have depressions in the hand. They have people request for fat grafting in the hand. Similarly, even in genitalia, people request for enhancing the size of the genitalia, and we can do that by fat grafting. Now the next question which comes to our mind is what exactly is done in fat grafting? Basically, fat grafting is a procedure in which we take fat by a technique which we use as a Coleman's technique. And we take fat from parts of our body which have excess of it. For example, people have flab in their tummy or their thighs and buttocks. We take that fat and we process it by a procedure by centrifuging it. And once we process it and then we separate the very fine fat, and by a technique of finely injecting, we put it to areas where it is required. So this is briefly a rough idea of what we do. Then something about the cost. Usually it costs somewhere between 25,000 to 60 to 70,000 depending on the amount of fat which needs to be injected. Then another question which might come to our mind is, are there any side effects? It is a routine procedure, pretty safe with usual side effects. The commonest one is that there is sometimes bruising in the areas from where we do liposuction and take out the fat. So but they usually settle down in 3 to 4 weeks. And the next question which might come to is how soon the patient can go back to work. Again, there is some amount of swelling which usually stays for 5 to 7 days, and the patient can resume work after 7 days to 10 days. Thank you.